Hello, and thank you for contacting Wave Support. I see from your clinical request that you're struggling a little bit with this patient, this post-LASIK patient. And sounds like overall the vision's very good, but you're a little concerned with the fit. You get some dropping of the lens down. It sounds like you get some bearing in the one meridian. And what I generally find with some of these corneas is, first of all, these post-LASIK or post-refractive surgery patients, usually the rules kind of go out the window, so you got to kind of fly by the seat of your pants a little bit. But with that said, sometimes we can use these the flexibility of Wave to kind of really reduce some of the bearing in those areas that are a little concerned about. So if we look at this, I know your design actually looks pretty good. I see exactly what you did to try to maximize this optical zone so it doesn't rub on that area. But basically, as you know, you've got basically a spherical lens on this kind of asymmetric, kind of weird looking cornea. And so one of my general thoughts is if I got a strange looking cornea like this, especially post-operative, I try to get as much data on the back surface of that lens to match as many little nook and crannies on the surface of that cornea as I can. And of course, we're all fearful of rubbing too hard here and there, so I tend to lean a little bit more toward either a geometrical, symmetric, or a freeform lens in these patients. So if we look at your lens, this actually looks pretty good. I just want to show you what happens if we kind of look at a maybe a freeform design. And as you recall, if we look at here, this is basically the topography that Wave is interpreting. So if you look at that's a relatively good facsimile of the actual topography, so we're actually doing pretty well there. And if you recall, this is the back surface of your lens, and I generally try to get this back surface of the lens to closely match this cornea as well as we can to try to minimize the areas of rubbing and everything else. And so if we go over here to GSIM lens, and you'll see if we just let that design a GSIM lens for us, you'll see what we come up with. Give it a moment here to kind of run through the design. We should be coming up here in momentarily. There we go. And so we see we have a pretty nice design there. But just curious, if we go to freeform, I still kind of like this, like to kind of match this back surface a little more closely to this. So I'm going to hit freeform here, and I'm going to let it design it. I'm going to pause the video while it's designing, and I'll see you in just momentarily. Okay, and welcome back. And so now I got a freeform design that more closely matches this. And in case you haven't used this little tool here, this has been a lot of the docs find this very helpful. It's a little asphericity tool for the optical zone. If I click on that, just add a little aspheric design to that, you'll see we now have a back surface that almost perfectly matches that cornea. And so again, this is another helpful tool that you can try. Again, most of the time you have to do a little trial and error with these fits. But if you're concerned with your fit, which I think is still a nice fit overall, but if you're getting some bearing in some undesirable areas, I would try to get this back surface to more closely mimic the front surface of the cornea. And one way to do that is maybe considering go to more of a free form and actually throw this aspheric tool, and you'll see that we have almost a perfect match on that back surface. Certainly you may have to go back to clean that up a little after looking at it clinically on the eye, but I think with a couple of those recommendations, you hopefully will have another tool to achieve the desired effect. With that said, I wish you well with this challenging case. These are very difficult cases, and I wish you well. Looks like you're pretty close on this one. Have a great day, and thank you for contacting Wave.